because I was so moved in the sense of infuriated and frustrated um, to see that Brett Stevens in the New York Times on February 22nd said that mask mandates made no difference in the pandemic. And the reason I am very frustrated about this um, is that he, rightly addresses something called the Cochrane Report, which is a multiple randomized controlled trial that found absolutely no difference for wearing masks versus not wearing masks. And this is something that 150 peer-reviewed studies that the Brownstone Institute has reported on for months and months has found long ago. And those of us on the critical side of the discussion about COVID, lockdown policies, masking, have known this for over a year and a half. So the New York Times finally came out and said, it really doesn't matter. This was a mistake. We shouldn't have done it. Um, and he concluded that, quote, mask mandates were a bust. So this is, such a cynical example of gatekeepers doing an about face as a new sheriff is in town with the Republican majority in Congress. And as the Pfizer documents reports, which we are doing here, Pfizer Daily Clout reports with the War Room Daily Clout, 3,500 medical and scientific experts showing that Pfizer lied and lied and lied, targeted fertility, damaged, caused strokes, caused brain hemorrhages, caused blood clots, caused 360-degree harms to fertility, to sperm counts, to sperm motility, to the hearts of minors, and on and on and on. And after Project Veritas got a Pfizer insider to confirm that they knew they were messing up the menstrual cycles of women, which is something for which I was deplatformed in June of 2021 from Twitter. And a lawsuit has since found that the White House and the CDC, Carol Crawford of the CDC, and Twitter and Facebook colluded illegally to deplatform me. All of these pieces of mounting evidence have made it untenable to go along with being on the wrong side of history around masking, lockdowns, and injections. However, just to not let the New York Times memory hole their horrific leadership, if not super evil complicity in the worst of setting the tone and the standard for all of these horrible things that we and our children have lived through, I want to read a section from my book, The Bodies of Others, which was published in March of 2022. The Bodies of Others. And so I wrote it in the end of 2021 into 2022. And the New York Times certainly played a gigantic role. So this is a spring of 2021, January of 2021 at this point in the book. And here's what the New York Times was doing. Many news outlets continued to miscommunicate studies or to feature flawed studies, all of which tended to heighten the level of their readers' fear and sense of helplessness. The New York Times was reporting on COVID droplets, quote unquote, and communicating the message essentially that you could get infected from any air in any context. Quote, as the CDC now advises, quote, avoid large and small gatherings in private places and public spaces, such as a friend's house, parks, restaurants, shops, or any other place, end quote. They actually said that pretty much includes everywhere. The New York Times showed a diagram, and this was so famous. Like, this was such a turning point for everyone I know in New York City, all my loved ones, all the kind of liberal, upper middle class and middle class people who read the New York Times across the country every day. This was absolutely a definitive, iconic story. The New York Times showed a diagram of a single study from Guangzhou, China, that purported to show how, quote, families A, B, and C, end quote, became sick from a single unnamed family that had purportedly traveled 520 miles from Wuhan, China, the day before Wuhan and its surrounding province locked down, and then had lunch in an unfortunate restaurant. Like, this was literally the story the New York Times told. The article was a death knell for the restaurant industry, as it concluded that air conditioning must have spread the disease and that even spacing tables was no panacea. The Times cited the CDC in relaying this message. Was this Chinese study, however, in a separate peer-reviewed publication? No, it was not. Quote, Chinese researchers described the incident in a paper that is to be published in the July issue of the Emerging Infectious Diseases, a journal published by the Centers for Disease Control and Prevention. In other words, the CDC was citing the CDC. So the study was not published in a separate peer-reviewed journal. The CDC was actually citing the CDC. Emerging Infectious Diseases is a CDC publication. Another flaw, quote, the field study has limitations. The researchers, for example, did not perform experiments to simulate the airborne transmission. This study that the New York Times is trumpeting from the rooftops with this super scary diagram showing how you are going to die if you go into a restaurant is this study that they are invoking was not an experiment to simulate the airborne transmission. It was a model. It was an hypothesis. Still another flaw, in how this study was reported was replicated in many studies cited by legacy media. Correlation is not causation. The Chinese researchers saw that someone in family A got sick. They saw that within 2 weeks, 9 others who had also been in the restaurant, quote, tested positive. 4 of these could have gotten sick elsewhere. They surmised, quote, but for the other 5, end quote, the New York Times wrote, quote, the restaurant appears to have been the source of the virus, end quote. But why could the other 5 not also have been infected elsewhere? A COVID infection does not have a timestamp. Indeed, this came up a lot at the beginning of the pandemic. The New York Times and other news outlets reported infections as if they were like a crime scene with DNA, as if you can tell exactly who and where and how someone got infected with COVID, and that's just not the case. Indeed, even the scientists who'd done the study, scientists living under the CCP regime with its watchful eye over scientists and research, had not made the certain claims that the New York Times implied that they had. Even these scientists acknowledged that the sick patients could have been infected elsewhere, which is to say, even under CCP oversight, the Chinese scientists were far more hesitant in their conclusions about the terribly, damagingly, dangerously infectious nature of a restaurant than was the New York Times in reporting the same study. But once again, what my mom and my relatives and my friends saw was a memorable schematic image in a newspaper which they all trusted, showing round tables with diners infecting one another right there, circled in lurid red. Cautioned the Times, quote, the social nature of dining out could increase the risk. The longer people linger in a contaminated area, the more virus particles they would likely inhale, end quote. So there was the takeaway from the vaunted New York Times. Breathing, talking, certainly dining socially could all horribly sicken or kill you. And by the way, quote, simply spacing tables 6 feet apart may not be sufficient to safeguard restaurant patrons, end quote. All of this was meant to illustrate, quote, some of the challenges that restaurants will face when they try to reopen, end quote. And, no mention here of opening a window or a door. And studies show that ventilation drops the concentration of viruses dramatically within a matter of minutes. This article mattered immensely. Throughout New York, people who'd regularly dined out their entire lives, providing the backbone of the city's restaurant industry, were now sure that dining out could be a death sentence. This article and others provided the grist for governors such as Cuomo and Massachusetts Governor Baker to, quote, restrict seating in bars and restaurants or to close these venues altogether. Once these measures were in place, they would not soon let up. Indeed, a full year into the pandemic, the New York Times was still claiming that bars and restaurants were a key source of COVID infections. They showcased another study that purported to correlate open restaurants with increased infections. Who was the Times now citing? The CDC's Dr. Walensky. And what was she now citing? Another CDC study. Nonetheless, even then, anyone who bothered to actually read the CDC study could not have failed to grasp its limitations. Among them, as the CDC itself confessed, quote, the analysis did not differentiate between indoor and outdoor dining, adequacy of ventilation, and adherence to physical distancing and occupancy requirements, end quote. Restaurant owners, horribly hard hit already, were driven to take issue with the, quote, science that the CDC was presenting as justification to keep their entire industry closed or restricted. And this is a quote. On Friday night, the National Restaurant Association, which represents 1 million restaurant and food service outlets, criticized the CDC study as, quote, an ill-informed attack on the industry hardest hit by the pandemic, end quote. It pointed out that researchers had not controlled for factors other than restaurant dining, such as business closures and other policies that might have contributed to coronavirus infections and deaths. Quote, if a positive correlation between ice cream sales and shark attacks is found, that would not mean that ice cream causes shark attacks, the association said in a statement. So the restaurant owners were doing better science than Rochelle Walensky. The restaurant owners were correct about the CDC and its methods. They were absolutely right, both logically and morally. These articles and proclamations had not come close to proving with replicable experiments or controlled studies published in peer-reviewed journals that open restaurants with proper ventilation, sanitation, and seating directly caused dramatically higher rates of COVID than did other venues. Stubbornly, published studies showed that households were the environments ripest for transmission, the same places into which we were corralled in order to, quote, stop the spread. After tens of thousands of restaurants had closed, a study showed that restaurants accounted for only 1.4% of all infections. But for all those businesses, for all those independent, hardworking business owners, many of them immigrants and members of communities of color, the facts could not help them anymore. It was already too late. So there you see, New York Times, you can't run, you can't hide. Just because in February of 2023, you, a year and a half late, run an op-ed saying, oops, masks do nothing, it doesn't absolve you from the journalistic crime, the economic crime, the moral crime of having done horrible journalism and horrible science in January of 2021, leading to the destruction of an entire sector of the economy. And on the basis of nothing, on the basis of no science, falsely leading people to believe that restaurants were more dangerous than any other place, that properly ventilated restaurants were more dangerous. There was just no evidence for it. It was not true. But I just want you to think about something. This was strategic, right? Closing restaurants and bars was strategic because the goal of these oligarchs that wanted to make war on humanity, they especially want to make war on human community. And people can communicate and share and compare their truths and their experiences when they're in a bar or in a restaurant. Imagine, and they can't when they're isolated in their homes, locked down, forbidden to congregate. So imagine if the two and a half years of lockdowns, mask mandates, vaccine mandates, crushing of our economy, mental health challenges, miseries of our children, if all of that would have been successfully prosecuted by these bad guys at the highest levels, if restaurants had stayed open, if real science had presented itself, and the New York Times had reported that there's no solid evidence that restaurants are pose any harm, especially if they're well ventilated with open windows or open doors. And people had been able to go to their local bar, local restaurant, meet with their friends and say, hey, how are you doing? Who's sick? Who's not sick? How are you guys holding up? And learn for themselves that there was a life to be had outside of lockdowns and outside of COVID hysteria, which turned out to be predicated on pretty much no solid evidence, as this book demonstrates. So I just want to share that, because I can't stand the memory hole. I can't stand the whitewashing of journalistic and moral crimes. The New York Times killed people. It's that simple. They killed people who were driven to deaths of despair because they lost their income, they lost their businesses. They crushed the dreams of 100,000 restaurant owners who had worked enslaved. Again, many of them immigrants, members of communities of color who could not pay their staff, who were forced to close their doors. They killed cultures, they killed neighborhoods, and all on the basis of a lie. And they led to absolute hysteria and isolation among older people like my mom, God bless her, who really believed that they would die if they met a friend for a cup of coffee in a restaurant or a cafe, or met a friend for a drink in a bar. And, I don't know what punishment the New York Times should suffer and its reporters should suffer for never having retracted that disgustingly false story. And there are other disgustingly false stories the New York Times reported, all the way from, fake backed up refrigerated morgues to fake, shock horror burials in Hart Island, which has always been a location of mass burials. All of this is exposed in the bodies of others. But the New York Times should apologize for all of its lies. They should, good journalistic ethics, disclose all of its errors, its lies, the lies about the refrigerated morgues, the lies about the masking necessary, due to this fake study of these Chinese diners who happened to have fled Wuhan the day before. All of its lies about Hart Island, needs to apologize, and no, an op-ed papering over journalistic crimes and moral crimes and civil crimes is not sufficient. Gray lady. So this is Dr. Naomi Wolf. Please continue to support us. Please support my podcast, Outspoken. Please support Daily Clout. And please do buy the War Room Daily Clout Pfizer documents, analysis reports, which are for sale all in one place, a record of the greatest crime against humanity, for sale on Kindle. Continue to support us, and we can keep bringing you this powerful the journalism that we do on Daily Clout every single day. Take care.